Okay, next station. Again, question number 1. What is this X-ray? Is it a plain study or contrast study? It is a contrast X-ray. Which area is exposed? Chest and upper abdomen. Right? You can see spine here. Okay. What area? What is the structure which has been specified? Esophagus. What are the findings? Yes, you can see this is filled with contrast, and here contrast is pushed inside. This is called shouldering sign. How is its regularity? It's irregular. What is the approximate length? So it's a lengthy, irregular growth inside the esophagus which is pushing the contrast medially. It's not like this. It has been pushed because of growth here. So most likely diagnosis, growth in the esophagus, and most likely esophageal carcinosis. What is this X-ray?
Plain X-ray.
Plain X-ray. Area has been exposed. Upper limb, which part? Lower end of the humerus, the elbow joint, whole of the radius and ulna, and part of wrist joint. What are the findings?
Displacement.
Grossly displaced. Which fracture? Supratrochlear fracture. You manage. How will you manage? So, what is the management?
Open and close.
Open or closed reduction and internal fixation with wires. So, the next station may have a scenario that a 65 years old lady presented with upper abdominal pain radiating to back, nausea, vomiting. On examination, she has tachycardia, she is dehydrated, and this will be the report. Serum amylase 1195 and bilirubin 38 milligram. So the question may be, what is the diagnosis? Most likely it is acute pancreatitis. Why? Because serum amylase has been raised 3 to 4 times more than normal. That criteria is mandatory to label a patient having pancreatitis. 3 times or 4 times above the normal value. Give 2 differential diagnoses in that case, not just looking at the serum amylase level. So a patient presenting with right upper abdominal pain, radiating to back, vomiting, nausea, acute cholecystitis. She may have biliary colic. This lady may have perforated duodenal ulcer. To do, especially in imaging studies, ultrasound abdomen, right? And then, if ultrasound has equivocal signs, then CT abdomen. So next important significant imaging investigation in case of acute pancreatitis is CT abdomen. So the next station may be showing this picture. The question will be, what are the findings? Discoloration of toes, big toe and little toe, and surrounding erythema, and there is distinct margin between gangrene and the normal tissue. and these are blackened, these are mummified. So this is that's why we call it gangrene. What are the causes? Most likely peripheral vascular disease or limb ischemia. So what are the surgical principles?
Amputation.
Amputation from
Divide.
where? Yes, amputation at your level, it's okay. You will amputate this dead part of the foot. But at a postgraduate level, amputation where? What next investigation would you like to do? CT angiography. Why? To see the level of healthy normal vessels, and then to perform amputation at an appropriate level. What will happen if you cut from here? Wound will not heal. That's why you get a CT angio and amputate the ischemic limb at an appropriate level. 50 years old executive presents with chronic backache, which starts from the lower back and radiates to the right leg up to the tip of right big toe. What is the most likely diagnosis?
Sciatica.
Most likely sciatica. What clinical test will you perform in this case? Clinical test you will perform in this case will be straight leg raising test, which will be restricted in this patient. Next question will be, how will you investigate this patient? You will say MRI of the spine. This is the MRI of that patient. What are the findings? Spinous processes of the vertebral column. What is this? These are vertebral bodies. And these are this one. What are these? Discs, spinal discs. These are spinal processes, and in between lies is. And what is this whitish part? Spinal cord. And what's happening here? What has gone wrong with the disc here? This disc has prolapsed and it is impinging on the spinal cord. The diagnosis is disc prolapse. There will be another scenario. A patient presents with swelling in front of neck, which moves on swallowing. She complains of anxiety, nervousness, preference for cold. On examination, she has a big goiter. Her pulse is 110 per minute, and she has tremors of hands and palmar sweating. What test will you advise?
Thyroid function test.
Thyroid function test. This is the thyroid function test report. What is the abnormality in this test?
TSH is low.
So first you have to notice is TSH. Normal value is 0.3 to 3, or in some labs 0.4 to 4 or 0.4 to 5. This lab report shows hyperthyroidism, but when it is associated with a large multinodular goiter, then this condition is labeled as toxic multinodular goiter. Your diagnosis will be toxic multinodular goiter. How will you manage? You will make the patient euthyroid.
Yes.
How? By antithyroid drugs. Which drugs?
Carbimazole, propyl.
Carbimazole, propyl thiouracil, in addition to beta blockers.
Propranolol.
Propranolol. And after making euthyroid, what is the definitive treatment
Surgical.
of this big goiter which is causing pressure symptoms?
Total thyroid.
Total thyroid.
Surgery or thyroidectomy. Right.